Excellency Ellen Johnson Sirleaf, former President of Liberia, Excellency Amina Gurib Fakim, former President of Mauritius, Dr. Tedros Ghebreyesus, DG of the WHO, Honorable Professor Mohammed Ali Pat, Coordinating Minister for Health and Social Welfare, Republic of Nigeria. We would remain standing as our dignitaries and us observe the Ghana National Anthem. Please be seated. I heard an applause. You can put your hands together for the Ghana National Anthem. Usually when this is played, it means we are ready to give Nigeria a good whipping in football. But because Baba is here, we will behave. Would like to first acknowledge the host and president of the Republic of Ghana, Excellency John Dramani Mahama. Welcome, sir. Please put your hands together for the president. We are privileged to have the former president of the Federal Republic of Nigeria, Excellency Olusegun Obasanjo, here with us. Thank you, sir. We are so grateful to have the former president of Liberia, Her Excellency Ellen Johnson Sirleaf, here with us. Thank you, ma'am. Extremely happy to have the former president of the Republic of Mauritius, Excellency Amina Gurib Fakim, also here with us. It's also a distinct honor to have the DG of the WHO, Dr. Tedros Ghebreyesus, here with us in Ghana. We have a whole raft of health ministers here. We would acknowledge all of them, but just for the purpose of protocol, I'd like to acknowledge, of course, the Minister of Health for Ghana, the host country, the Honorable Kobna Minta Akando. And of course, our cousin, the Honorable Professor Mohammed Ali Pat, Coordinating Minister of Health and Social Welfare for Nigeria. You are officially welcome to the Accra Health Sovereignty Summit, dubbed the Accra Initiative, happening today in the capital of Ghana, which is the gateway to Africa. When we say that, usually some people say Ghana is the gateway, we are the final destination. But there are three.
Built in a different era, no longer reflects Africa's realities of this time. It is no longer fit for purpose. This high-level summit is our response. It is a call to reimagine health governance through African leadership and continental sovereignty. This summit is not a ceremonial meeting. It is a working co-creation. Lay the foundation for a presidential task force to design a time-bound, actionable framework for reforming global health governance in line with our national and continental priorities. We are also seeking to reflect on the changing global health landscape and its impact on Africa, both the risks and opportunities before us. We also seek to co-create bold, sovereign solutions that will influence a reimagined global health governance architecture with Africa as its center. We will endorse a sustained framework. This will be our vehicle for safeguarding health gains, driving country-led reforms, and preparing our systems for the future. We will define a clear roadmap beyond Accra, ensuring that the solutions we design here are socialized and adopted through key African and global milestones. From the African Union summits to the United Nations General Assembly and other global health fora, so that our collective voice is heard and acted upon. These outcomes are not just words on paper. They are the roadmap for delivery, from Rome to national capitals, and from our continent to the global stage. This summit is also a signal to the world that Africa is no longer a passive participant in global health governance, that we are authors of the reforms we need. We are investors on our own systems, and we are partners to the world on equal terms. By working together today, we are launching an Africa-led initiative that can reshape not only our continental approach, but also the global health order. We are going to make it more inclusive, more resilient, and more reflective of today's realities. So this is a call to action. Excellencies, ladies and gentlemen, on behalf of His Excellency President John Dramani Mahama, I thank you all for joining us and for your commitment to building a new era of health sovereignty. Let us leave Accra with bold outcomes, actionable next steps, and a shared determination to protect the health, sovereignty, and dignity of our people. And let us carry this work forward to every milestone, from every AU meeting, and also the United Nations. Let's carry this forward until these solutions are fully embraced and fully implemented. Thank you.
People in pharmaceutical. So I thought I was in the wrong place. When I went to them, I said, look, we are here for afforestation. Why are you here? And they said they were in for afforestation too. And they told me and said, 80% of the drugs we buy in the pharmacies have their origin in herbs. And what is happening is that these trees are being cut, they are being destroyed, and they have not extracted enough from the herbs. I learned a lesson from there. So the herbs that we have in our villages and rural areas are useful. And even the pharmaceuticals of the world have 80% of what they sell to us having their origin from herbs. At the family and community level, we can use more herbs than we are using traditional medicine. At the national level, I believe that there's virtually no country in Africa today that doesn't have health insurance in one form or the other. We can expand and enhance health insurance. And 25% of our health insurance fund can be used to manage our health architecture and go into health infrastructure. At the continental level, just as we have now risen to have a peace fund, and I tell you what that peace fund has started to do. When I was appointed Special Envoy for the Horn of Africa, and I was handling the situation in Ethiopia, AU was waiting for European money before I could start, or American money. Today, 5 of us have been appointed as facilitator for DRC and Rwanda. Immediately, AU made available $1 million out of peace fund. That is progress. I believe we can have a health fund for Africa. And this health fund can be managed by Africa Development Bank. And the source, to start with, something like $100 for flying into Africa or flying out of Africa, but not for traveling within Africa. And then, of course, we can see what else we can do to enhance that fund. But we need health fund for Africa. Global, I believe at the global level, we should have health security for all. Health security for all. Here in this country, some time ago, the slogan was Ghana Beyond Aid. I believe the slogan for us should be now Africa Health Without Aid. But with global partnership, solidarity, cooperation, and collaboration, and of course, togetherness. Because pandemic, as we have seen, knows no geographical boundary, knows no borders. We have to work separately and together for security for all, health security for all. Thank you.
Thank you, Your Excellency.
That has for far too long excluded Africa's voices, excluded Africa's needs and innovations. We're called to build systems that do more than respond to crisis. We must build systems that generate resilience, produce equity, and amplify dignity of our people. Let me be clear. We've seen profound global health achievements over the past decades. That is true. And let us honor those successes. For instance, child mortality has been halved since the 1990s. Maternal deaths have dropped by over 40% since the year 2000. Over 29 million people now have access to life-saving antiretroviral treatments. Millions are living longer and healthier lives due to cleaner air, better sanitation, and innovative health systems. These gains have not been by accident. They've been the fruits of bold partnerships like Gavi, the Alliance for Vaccination, the Global Fund, PEPFAR, unfortunately, that's part of the program that has been cancelled under USAID, and many others. But even as we celebrate, we must confront the truth. These gains are now under siege. In 2023, global development assistance declined sharply, and Africa felt the shock. Immediately, maternal health programs halted, vaccine supplies delayed, and medicines disappeared from the clinical shelves. In Ghana, our community-based health delivery model, which we call the CHIPS compound programs, was brought to its knees by abrupt funding withdrawals. The ripple effects were felt all across our country, from Dodowa to Damango. This is not merely a funding gap, it is a crisis of imagination, a vacuum of solidarity, and a deep failure of shared responsibility. Above all, it is a question of the sovereignty, the right of African nations to determine their health priorities, marshal their capacities, and lead with their own vision. And so out of adversity comes opportunity. Africa must no longer be the patient. It must be the driver. It must be the author. It must be the architect and the advocate of its own health destiny. Let us remember that Africa is not new to global health leadership. When HIV and AIDS ravaged our continent, African leaders like President Olusegun Obasanjo and the late Kofi Annan of blessed memory helped catalyze global responses that birthed the Global Fund and Gavi. When Ebola struck West Africa, President Ellen Johnson Sirleaf and her colleagues became a moral compass for the conscience of the continent. During COVID-19, President Cyril Ramaphosa rallied the African Union into collective action on vaccine access. Today, President William Ruto is leading the charge to eliminate malaria as a continental scourge. Today, President Kagame is the African champion on domestic health financing and is leading advocacy in building resilient, self-reliant African health systems. We've built enduring institutions like CDC, Panabios, the African Medicine Agency, that are not merely bureaucracies. These are symbols of an emerging African health ecosystem that is rooted in digital innovation, it is grounded in data, and designed for self-determination by African countries. Your Excellencies, ladies and gentlemen, here in Ghana,